Hi, my name's Scott McGann with the Falmouth Health Department. Today's December 30th, 2022, doing our every other week COVID update for the town of Falmouth. Let's jump into it. We're at 5,987 PCR positive COVID cases. This does not track any antigen or any home tests. There's a multiplier that would be sometimes higher than that. It could be 3, 4, 5 times higher. Don't know. 100 confirmed PCRs over the 2-week span of the 15th to the 29th of this month. It was 62 for the earlier in the month for the 2 weeks. Averages out in the low 40s. That's just PCR. So again, an increase in COVID during the holidays is what we see. I'm not telling people they should not be going to do stuff. You should be. But it does increase more people you see, people you hadn't seen in a while. It mixes it all up, and you're going to start seeing an increase after the holidays, much like you did every year prior to COVID with colds and flus and so forth, generally speaking. So Falmouth's 14-day incidence rate jumped 3.8 to 20.9 and went up 1.16 to 8.4% positivity. We're in, the CDC gives this out every week. On Thursdays, we're in the medium, or on the high medium. We're usually in the low high range or the low medium range, high low range or low medium range. But we have one metric, 18.4, which is our COVID admissions per 100,000, jumped up 4.9 to 18.4. Once that goes over 19.9 and hits 20, we'll be in the high, and there are some counties in Massachusetts, the Great Metro New York area as well, and other parts of the country that are on high based on this metric here. More COVID. There are fair amount of COVID out there right now. Will increase the hospitalizations. I'll also mention another reason why maybe when I talk about vaccines as well. So COVID rising on this time of year, much like colds and flus, isn't abnormal. I think this is going to be a time of year, as long as COVID's here, that you're going to tend to have an increase. So, we'll see what happens for next week, but we are pushing. If we jump up, 1.5, a little more, 1.6 or so, we're going to jump into the high category next week. So let's see what happens. As far as hospitalizations, the far right tells you the more recent data. You can see an upward trend in hospitalizations, more COVID, more likelihood of hospitalizations. We're similar, or even a little higher than we were with a blip that we had in May. Still nowhere near the Omicron, which is the first giant peak in January 22, or the Delta one in January 21. Again, here's our incidence rate, 20.9. On the higher side, there are other towns that are higher, but some towns are lower. And in incidence rate, we're slightly maybe on a little bit of a lower end of as opposed to being in sort of the medium high on the incidence rate. 8,327 cases over that time period is almost exactly the same last time, at least for the state, this state chart. Trends are still, up a bit on positivity, flat on cases, flat on deaths. Hospitalization shows an uptick similar to what we see with that previous chart I showed you up here with the county data from CDC. Wastewater is a very good indicator. So viral signals in wastewater. The far left, you see it off the chart from when the original Omicron last January. And then it sort of meanders a bit up in that May area. We had a little blip, and then it's flattened out in the summer, blip up in the fall, dip back down. You see, but both the south area of the MWRA is the wastewater for Greater Boston area. It's a good indicator. Shows an upward in the orange. The orange color is for the south of Boston. The north of Boston is very similar in green. Shows it going up. So an upward trend after the holidays with COVID, with people getting together and so forth. Look at the airports now, everybody crammed in long lines and things like that. It's going to cause an increase, and that's what it's done. Boosters are still recommended, of course, 5 and older. You still get at that. As far as testing, as far as vaccines, you still go on vaxfinder.mass.gov and schedule yourself a vaccine. Testing can be done at the pharmacies, the hospital. Most people are using the home kits. The thing about the home kits is if you've got symptoms and you were exposed and you're negative, test again in 24 hours. Sometimes you have a low viral load where it doesn't necessarily pick it up, and it picks it up as the virus continues to grow inside of you. So that's, again, if you're symptomatic and your niece had it and you were together, last Thursday and today's Saturday, and likelihood is if If you're hanging around with somebody with the flu and then all of a sudden you get flu-like symptoms, well, you got the flu from somebody. And it's the same thing with COVID. If you know you've got a known exposure and you got symptoms, or even symptoms in general, you take the 2 home tests, 24 hours apart, a really good, better way. If it tests positive, it's not false positive. It just can show negative if the viral load's on the low side. Vaccines, I'm not going to bore you with this. You can see, though, one thing I do want to say, there's no way we had 30,056 out of the 32,000 people get their first shot. So some of these are because when the person given the shot fills out the form, the person may not know they've had it, or they may not have said they had it. For example, if someone went into the caregiver wasn't there that was originally brought the person, and the person didn't have a card, you'd check them off as the first. So some of these first and second doses kind of belong more towards the boosters. The boosters are probably a little artificially low, but that being said, let's say it's a 10% or so switch. You have 82% of the population and 10% added into the boosters. The boosters are still at 10%, still 9,000. So let's say we're at 13,000. Still, most people in town have not gotten the second booster. And about, roughly, let's say 60% got the first booster. So maybe with the waning of the boosters, of the shots, perhaps some of the reasons why this hospitalization is a lack of, especially when you look at the older age groups, 75, 50 plus, let's say up in that area, those numbers aren't as high as the first dose. So as the virus wanes and morphs into other types of Omicrons, that and just the sheer number of people, going about their lives normally, that's where you get that increase. And that's what I would say would be the reason why. So if you got the first series, consider yourself getting that booster, or if you have just had one booster, consider getting the second booster. And the second booster is obviously more Omicron specific because over time they've changed the formulation. It's bivalent, the bivalent booster. So that's what I would suggest that could be one of the reasons why. And as far as variants go, you can see who's taking over. Over time, it looked like a rainbow of different variants, and over time you can see that the BA.5 is finally being outcompeted, but it's not being by the BQ.1 that never took full hold. You can see it never got over 50%, and the BQ.1.1 never got over 50%. But what you do see getting over 50% really quick is that XBB. So that's the new variant that's going to take over. It's sort of squashed the BF7 and all these other little ones, all these other colors up top, whatever you want to call, all of them on the side here, what they're numbered. But you can see that the lavender-colored XBB is taking over, so that's going to be the newest variant. That's going to be more like in that BA.5 range that you saw in the early fall, where it was more the dominant, and it's working its way that way. So I would say by next week you'll see more lavender in the far right, and that'll just explain that that's what's going on. So as far as a recap, there's plenty of COVID around, there's plenty of flu around, plenty of RSV around. It is cold and flu season. This is another one that's taken hold. The hospitalizations are up, not to a point where they can't handle it or anything like that, but hospitalizations are up, and that could be part of just the sheer number of, a lot of COVID around, and also the lack or the lower booster rates than maybe that I would think we would have probably had by now. There is plenty of vaccine. You do have to go on VaxFinder, make an appointment. So if it's a week or so, that's not too bad. Obviously, there was a little bit of dip over the holidays because people just they would have gotten it a couple weeks earlier. So there'd be a little bit dip because people are away. BA.5 is no longer the dominant strain that XBB is. There are no mandates or advisories other than a suggestion or advisory to wear a mask in town-owned property that's been left on by the select board. But other than that, there are no mandates or any discussions of that, any of the calls and so forth. There has been some discussion on the news at schools up in Boston, but nothing from there. And also the cases are more towards adults. We don't see a spike with the kids per se. So the vast majority are with adults. So I think it follows that, the older and more vulnerable you are, the more likely you're going to have COVID at a point where it's going to, make you pretty ill if you're in that category and you haven't been boosted, and that's where you get the hospitalizations going up. Not up where it was like it was last January. So think about this. So January of 2020 into 2021. So January 21, that winter, we had Delta. Then last winter in January, we had that big Omicron where there was just a boatload of cases with Omicron, the original. You're not seeing those two. I don't think you're going to see a spike like those two. You could. then, you could, but I think with the bivalent booster and over time, these peaks that you'd seen the first couple of winters in the January timeframe will be slighter, but up. So up, not out of control. So that's kind of where we're at. So that's my update. We'll do one again in a couple of weeks. And so if you have any questions, you can always call or email the health department. Thanks.